Hello, and welcome to Your Health, Wealth, and Happiness. I'm your host, Brittany Maxwell. For this episode, we are going to be covering eye care and vision problems. Today we have Dr. Sadiq here to give us her advice on some of the most common eye problems our viewers have. Thank you for joining us here today, Dr. Sadiq.
Thank you for having me, Brittany.
We're always so happy to have you here. I'm sure many of our viewers have been curious about eye care. Especially with the weather these days becoming colder, our eyes tend to feel a bit drier. What are some of the causes of dry eyes, and do you have any recommendations for them?
It is generally caused by a decreased tear production by a gland which is known as lacrimal gland, and it is located in the right upper corner of our eye, and it produces a layer of film, tear film, which helps us our eyes hydrated. And the treatment of dry eyes can vary case to case. If there is inflammation of the cornea, that is very serious, and you need to see your doctor right away. And if sometimes symptoms are not actually that serious, but you're still uncomfortable having a dry eyes, so the treatment can depend on changing your lifestyle or just like using artificial tear. Especially the young people, if they are having the dryness of the eyes, and that can be usually the reason can be very simple. They are up all night watching TV or using their iPad, iPhone. That can be the simple reason.
Right.
So I think our bodies are designed to sleep at night. So as our gland also perform less at night, so I think we should be resting at night. That will be helpful.
I heard another thing is contact lenses can maybe be a source of dry eyes. Many people are debating whether or not hard lenses are better than soft lenses. What's your opinion on that?
I think hard lenses are always better because it has more oxygen permeability and it covers less area of the eye. But mostly people use the soft lenses. But I would recommend that see your doctor, but hard lenses are better. But always glasses are the best.
Oh yeah, I was just about to ask that. Not as fashionable though, right?
Yeah, it depends. Some people look very scholarly.
And many people tend to use eye drops as well as a solution for their dry eyes. Would you recommend to use it?
Actually, eye drops, I would not recommend to use it too frequently. You shouldn't rely on that all the time.
Why is that?
Because if you are putting the solution from outside, you are making your lacrimal gland lazy. So if you don't use it, you lose it. So use it sparingly.
So what are floaters?
Actually, floaters are they are like gel-like vitreous inside the eye, behind the eye, and at times the consistency of vitreous changes, and that is known as retina. Actually, they got retina vitreous detachment, and they cause spots and flashes of light and floaters. But if this extend to another level, which we call retina detachment, that can be very serious. Usually floaters and flashes are not a big deal, they are harmless. But if there is a detachment of retina, that can cause immediate blindness, and you need to see your doctor right away.
That doesn't sound pleasant at all if floaters do occur, but I'm glad that they normally tend to be harmless. I feel like I'm learning so much here today with you, Dr. Sadiq, about eye care, but can you give us a little bit more information about vision?
Actually, I have a question. You want to give it a try?
Oh boy, sure, why not?
What are some of the habits which can make your eyesight worse? Choice number 1, reading a book in a bus. Number 2, looking at the laptop. Number 3, reading a book in a dark room. What is your choice?
I would say 3, reading a book in the dark.
Actually, there's none.
Really?
Yeah. These factors actually can force your ciliary muscles to work. Therefore, they will make your eyes get tired. However, they cannot be the cause of worsening your vision.
But what can cause your eyesight to decrease then?
Usually it's genetic and also structural changes. As we grow older, our structure of the eyes changes, eyeball size changes, and then next is eye diseases. That can also be a big part of it at times. But as we grow older, our eyes actually needs more attention and maintenance, and you need to take care of your eyes, not forcing your eyes to be overworked. Our body is like a car. It has a wear and tear, so we need to maintain it. If we don't maintain it, we'll lose it. So we need to keep taking care of our body.
Well, I couldn't have said it better myself, Dr. Sadiq. And thank you so much for joining us here today.
Thank you.
And until next time, viewers, stay healthy, happy, and live better.